So we are talking about the abdominal pain in the infant, child, and adolescent. So we have to know about that. The diagnosis in the infant, it will be very hard even in the childhood, because it will be difficult for us to get the information from the patient. They are not like adult people, they can express themselves about the pain. So the main problem is the communication problem with the patient. So we have two kinds of the pains, which is we are divided them according to the medical like skills. So we have surgical and medical, I mean the clinical ones. So in the infant, surgically we have invagination of the intestine, which is causing pain, hernia, volvulus, and appendicitis. And clinically, colic pain, GERD, acute gastroenteritis, viral syndrome, milk protein allergy, and neoplasm. And right now, about the child, surgically we have appendicitis, invagination of the intestine, and hernia, trauma, testicular torsion, renal stones, acute gastroenteritis, urinary tract infection, labor, pneumonia, functional abdominal pain, viral syndromes, streptococcal pharyngitis, constipation, hemolytic uremic syndrome, inflammatory bowel disease, diabetic ketoacidosis, and some other causes. And in an adolescent, we have trauma, appendicitis, ectopic pregnancy, and testicular or ovarian torsion surgically. So clinically, renal stone, cholecystitis, acute gastroenteritis, urinary tract infection, pelvic inflammatory disease, dysmenorrhea, inflammatory bowel disease, diabetic ketoacidosis, and pancreatitis. So for the diagnosis in the child and adolescent, we have to do mostly the physical examination and other like instrumental examinations. So according to the physical examination, we have to have scales and to know about the parts of the abdomen according to the quadrants, like epigastrium, like umbilical position, and like right hypochondrium, left hypochondrium, inguinal, so on. So for this, every kind of the pathology we can find in a anatomical position, and we have to search for it. So we have other instrumental tests, instrumental investigations, which is helping us for inflammation and for the other diseases, like maybe it is about the allergic reaction, like a serum. So if it is viral infection or any other, like we do CBC, we do C protein reaction, and so on. And about the anatomical problems, which is the pathology of the anatomical organs, we have to do ultrasound, and we can do CT scan in the child and adolescent. So it will be so important for us to search for it very accurately. And mainly we are now concentrating on the facial expression while we are doing physical examination, and we are looking at the face of the patient, and we are trying to communicate with the child and getting information. So if the patient was not able to answer in very well, so we can get information from mom or from dad and the duration of the disease and so on and so on. Right now we are talking about the pathogenesis. Abdominal pain falls into three clinical categories: visceral, parietal, and referred pain. A general understanding of this is helpful in determining the case of the abdominal pain. So the first one is visceral pain is poorly localized and is often described as a dull and aching pain. It's caused by stretching, distension, or ischemia of the viscera. Parietal pain is well localized, discrete, and often described as a sharp and intense in a character. Pain is stimulated by the stretching, inflammation, or ischemia of the parietal peritoneum. So the pain in the appendicitis, it has both character, parietal and also the visceral. And in 84 hours it's migrating to the right lumbar region. So in a referred pain is often perceived at the site of descent from the originated organ and may be described either as a sharp and localized or as a vagus aching sensation. Examples including irritation of the parietal pleura of the lung, perceived as an abdominal wall, and inflammation of the gallbladder, perceived as a scapular pain. It is helpful to classify the causes of acute abdominal pain by age. There are many potential causes of abdominal pain, including infection, anatomic, traumatic, inflammatory, and functional and oncological. Characteristics, and we can use it as a differential diagnosis in the primary diagnosis. So in acute abdominal pain, we have to communicate with the patient if they are not so young or infant to show us the position of the pain, and in the infant and younger children will be more difficult because they are not able to show anything. So we are searching according to the behavior of the patient. When the infant having pain, they are trying to raise up their legs up to their abdomen, and then if the pain is characteristics of the invagination of the intestine, it has cramping pain, and it is discontinued pain when the movement of the bowel will be inverted, then the pain will relieve. And when the movement of the bowel will be in the normal direction because of the invagination or because of the obstruction, will be very high and the patient starting to cry. So this one was the surgical characteristics of the pain in the infant. And when we are going to talk about the characteristics of the appendicitis, it is a little bit different. In the infant and children, it is not as like the classical type, and then we have to differentiate the diagnosis and the type of the pain according to the the behavior of the patient also again. And we have to search by the ultrasound, which is the most good variant for the differential diagnosis and the most instrumental diagnostics, and it can show the inflammatory process sometimes because of the edema of the lumen of the appendix, and we can see the lumen of the intestine and problems which are the patient have in the intestine. And when there will be invagination or bowel obstruction, also we can see it by the um, ultrasound, because the patient's abdomen is so light, and we can see through the ultrasound without a problem. And after the age of the 5 year, we can use others like radiological examinations, and will be more suitable in the adolescent and in the patient which is older than 5 years. So now about the bowel infectious diseases, we have to search for the type of the bacteria and the stool investigations to be sure about the infectious disease. Maybe the patient having the temperature, and if the patient having pelvic inflammatory disease, also they have uh, they have to do urine analysis, and if there is a neutrophil in the urine, or if there is any kind of the things like blood inside of the urine, which is characteristic of the renal stone, or if the cholecystitis, it will be showed up in the color of the stool and investigation of the stool. So according to the type of the disease, we are doing the management of the pain, and we are searching for the cause of the pain first of all, and then we are going to treat the disease of the patient. So the presentation is finished. I have to say goodbye to you, and thank you for your attention.